Joy Daniel is a sickle cell patient. Growing up, she had a challenging childhood as her parents had no idea of her condition. Moving from one health facility to the other was regular on the family's calendar. Her daughter, Chidindu Daniel, is also a sufferer, but her story will be different as she was screened immediately after birth.
She was born July 13th, 2017 here in Kolebu. So when I gave birth, newborn screening on my baby, and she's fine since then. Since I've been coming to clinic, once in a month they check on her, so she's fine. No attack, no sick, nothing. She's fine.
Chidindu is one of the few babies hopeful of a better life as a sickle cell patient. However, there are hundreds, if not thousands, of babies who do not live to see age 5 due to late diagnosis of the condition in newborns. Sub-Saharan Africa is home to over 80% of babies born with sickle cell diseases globally. The NGO Sickle Cell Foundation is worried governments have neglected the disease.
Is it so expensive that our country cannot afford it? It probably costs about 40 cedis for a baby. That is not the most expensive intervention. And when we diagnose them, the medicine that they take that keeps them alive is ordinary penicillin. They take it twice a day for at least the first 5 years of life. That is also very inexpensive. And in fact, the National Health Insurance Authority pays for the penicillin for the babies we've diagnosed. But they say they don't have enough money to pay for the screening. So here we are losing babies, and the treatment that could save their lives is cheap enough for us to afford it.
One major complication of sickle cell disease is childhood stroke, which is a #1 cause of deaths and deformities in children with the condition. Professor Isaac Odame of the Sick Kids Center for Global Child Health says funds will soon be made available for SCD children with stroke to freely access therapy.
So newborn screening is not only to prevent early death, it is also to ensure that you prevent complications of the disease, particularly like stroke. A child with stroke is a burden to the family for as long as they live, a burden to the healthcare system. They're not able to get education. They're not able to get the skills to contribute to national development. So we want to prevent early death, but not only that, we want to give these children good quality life. And that is why we're going to make access to hydroxyurea possible so that the children can live a good quality life.
In all of it, there is hope for babies born at Kolebu Teaching Hospital. As a year into the first phase of newborn screening program, all 74 sickle cell positive babies out of the over 4,000 newborn babies screened have been enrolled in the special newborn clinic and are thriving. Charity Emil Batel's report for Joy News.